the center when it comes to providing skilled and compassionate care for women, for their newborns, infants, and for their families and communities. With the solid leadership of the Ministry of Health and with the support from the government of Sweden and other development partners, we have come a long way in working together with Uganda's midwives to ensure the health and the well-being of mothers and that of their babies. As you know, this year's theme of the International Midwife Day is Midwives Leading the Way with Quality Care. It highlights the vital role that all of you play, not only in ensuring that women and their newborns navigate the pregnancy, the childbirth safely, but that also that everyone is receiving the maternity care that is respectful and that creates a lifetime of good health and well-being. Every year in Uganda, 6,000 women are dying from the complications of pregnancies or during childbirth. And the majority of these deaths could be prevented if there were enough qualified and adequately resourced midwives available to walk with them on this journey of giving life. Now, it is due in large part of your work that Uganda has managed to reduce maternal mortality very significantly from 500 deaths per 100,000 live births in 2001 to 336 deaths in 2017. That is a remarkable achievement. Now, yes, you can clap for yourselves. You are deeply committed to mothers, to save mothers and their babies. Now, however, I would like to highlight a few challenges that you are facing. Number one, undermines at some times the quality of services. Despite the fact that Uganda has over 75% of the required midwifery workforce, despite the fact that Uganda has 75% of the required workforce, this is a slight misrepresentation when one considers the overgrowing population needs. Number two, inadequate remuneration, especially with increasing cost of living. Also, poor working conditions, such as the lack of accommodation facilities at the workplaces. The limited recognition that undermines your motivation. Inadequate availability of essential drugs and supplies in health facilities that limit your ability to provide basic quality obstetric care, and limited opportunities for professional and career growth. Now, at UNFPA and with the Ministry of Health and the Ministry of Education and Sports, we really have done a lot to lay the foundation of midwifery in this country. Let me just allow me please to just give you the fact that with a very generous support of the government of Sweden, we have trained in the last 7 years 567 midwives, and we've also equipped 18 midwifery training schools, and we have supported the decentralization of the functions of the Uganda Nurses and Midwives Council to 13 regional referral hospitals. But we still need to do much more. And so we are determined to invest in the recruitment of already trained midwives and deploy them, especially in hard-to-reach areas. We also commit to strengthen the midwifery education services and initiatives with increased access to higher education and to professional development. Because investing in midwifery education is a win-win and a best buy that can yield a 16-fold return on investment in terms of the lives that you are saving. So thank you very much for that. Your facilities need to be equipped to offer the appropriate services, and that includes, of course, the services during emergencies, such as safe blood, cesarean sections, and also the resuscitation of the newborn. We commit to legislation, regulation, and licensing, strengthening of midwifery, so that we can allow you to provide the high-quality care that you need. And we also commit to work to improve the working conditions for midwives. The midwifery professionals need salaries that adequately reflect the level of your skills. Above all, we really commit to put midwives in charge, to lead the efforts to improve quality of care, You yourselves have the solutions and insights into how to overcome those barriers and how to create that positive change. And we really need to start and do much better in terms of listening to their voices and putting you at the center of policy making and decision making at all levels. And my presence here signifies